Welcome to Wellness Wednesdays. There's a few people that are joining, so just want to give them a moment to join. I missed you all last week. There's a story behind that, but I'll tell that at another time. Thank you all so much for being here. Again, this is Dr. Latoya Wells with Wells Legacy Health and Wellness. I am a family nurse practitioner and I own Wells Legacy Health and Wellness, which is a health and wellness business company organization that focuses on the whole person. So we deal with the body, we talk about your mind, we talk about your soul, all of that good stuff. We go beyond the office. Um, we provide CPR services. We provide community outreach resources. We provide telehealth. But my passion is education and making sure that my family, my community, and those that I know are educated and have the information that they need to be successful in their health. So, tonight we're going to be discussing cholesterol, the good, the bad, and the ugly of cholesterol. So, as we mentioned I think it was in February when we were discussing heart health, we talked about the cholesterol a little bit. And I'm just trying to get some notes up here. Um, I was running around a little bit trying to get ready, and my notes are on the printer. So I'm going to go ahead and pull up some additional. I got my notes here, but just wanted to talk with you all a little bit about cholesterol and what cholesterol is and what it means and all of that good stuff. When you go to your primary care doctor's office for your annual physical exam, you should be getting blood work ran every year. And based on the results of your blood work, will determine and tell you a few things. And one of the main things that's included in the blood work is your lipid panel, which is your cholesterol. And so when you get your cholesterol levels, we're looking at a few different things, right? We want to look at the overall cholesterol. You want to look at your total cholesterol. You're looking at the high cholesterol, low cholesterol. There's a HDL, there's a LDL. So understanding what all of that means. Your cholesterol is the fatty substance that's within your blood, right? So we eat food. Once we eat the foods then break down and it releases certain particles within our bodies. And so with the foods that we eat, one of the things that is within the foods that we eat is cholesterol, fatty substances, right? And so when you eat, those substances begin to be broken down and then they are released into your body. And so the cholesterol is a fatty substance in the blood. It's essential for bodily functions, right? There's certain body organs and function within our body where we need that fat. But what happens is when you have an individual who either has a family history of high cholesterol, or they have heart disease, or they have diabetes, or some other medical condition, that having an elevated cholesterol or amount of fat within your blood can be a problem. So it's essential for the body, but high levels increase your risk for heart disease. So if you have someone that has some of those, diseases that I just mentioned, it puts them at a higher risk for developing other problems, particularly heart disease. So if you have a family history of heart disease, a family history of diabetes, family history of high blood pressure, you should be having these levels looked at closely. Okay. So when you go to your physical exam, part of your blood work should include a lipid panel. There's two main types of cholesterol. You have the LDL, which is the low density lipoprotein. And then you have the HDL, which is the high density lipoprotein. Okay, so normal cholesterol levels, the total cholesterol should be less than 200 milligrams per deciliter, or 200, right? We just want to go with 200. Your LDL should be less than 100. And your HDL should be above 60, right? In order to have that protective factor there. But if it's below 40, then it's on the low end, okay? So what can we do for the cholesterol? There are several different things that we can do. One thing is you want to make sure you're getting the blood work, as I mentioned. You're getting these screenings every year. And if your levels are elevated, then your healthcare provider should be talking to you about your diet, family history, your past medical history, right? And so dietary choices is going to be the number one, right? Whenever I have a patient come in and we do their blood work and it shows that they have elevation on either one of those three, the total cholesterol, the HDL, or the LDL. There's some other numbers in that lipid panel that we're looking at, but these are the ones that we primarily are going to be looking at. So one of the first things I want to do is talk with them about their diet. What is your diet? What are you eating? What's on your plate? Remember, we talked about the plate planner. And so the proteins that's on there is the lean protein, right? So you want a heart healthy diet can manage cholesterol before we even get to medications. Now, there are some situations where these individuals have a familiar history of high cholesterol and their cholesterol levels are just resistant to anything that we've done, diet, exercise, and we have to place them on something for their cholesterol. But first step in managing the cholesterol is monitoring your diet. A heart healthy diet can help manage cholesterol. So we want to focus on foods that are high in soluble fiber, such as oats, beans, fruits, veggies, and things of that nature, because they help lower the LDL. Fiber tends to bind to the fat molecule and helps your body rid it fairly quickly and easily. So that's why we mentioned those foods that are high in soluble fiber. Limit saturated fats found in red meats, full fat dairy products, the fried foods. You want to avoid trans fat, commonly found again in fried foods. Not saying that we can't have the fried food, but if we're going to, one of the healthier options is to use an air fryer or find an oil that is not as high in those saturated fats. The olive oil and the grapeseed oil and things of that nature that we use to fry foods in can be an alternative to the regular cooking oil, right? You want to include sources of healthy fats, the omega-3s found in the fish, the salmon, and some nuts. Again, now, if you have allergies to these things, then we need to look at some different alternatives for you. There are some supplements. So we've started the diet. We're working on the exercising, and the levels still aren't where we want them to be. So we go and we look at some supplements. So some supplements may help lower the cholesterol, but we want to make sure you're consulting with your primary care doctors. We've heard in media, social media, and things like that, that taking the fish oil, the omega-3s can help lower the triglycerides. And that is true to some extent. I can't give you recommendations on any particular supplement, just giving you the knowledge so that you are aware of it. Plant sterols or stanol supplements can block the absorption of cholesterol in the intestine. So certain supplements, as we mentioned, the fiber, and also some of the omega-3s and some of the plant sterols or plant supplements can bind to that fat and lower the cholesterols, right? So it gets it out of your system before it is absorbed in the body and it's found in your blood. We talked about exercise. So regular physical exercise can help raise the LDL, which is the good cholesterol. And I forgot to mention that when we're talking about cholesterol, the good, bad, and the ugly, right? The HDL is the good cholesterol, and the bad cholesterol is the LDL. So when we're talking about getting that HDL elevated, exercise can help with that. The LDL is going to be lowered by the foods that we're eating, right? Making sure that we're eating those healthy foods. So the good is the HDL, the bad is the LDL. So you want to look at it high. We want to make sure that number is high, the HDL. LDL low, we want to make sure we're keeping that low, as well as the total cholesterol. We want that to be below 200. Exercise, exercise, exercise. And we've talked about this time and time again. 30 minutes at least 5 times a week. So 150 minutes of moderate intensity exercise, or 75 minutes of vigorous exercise per week. So what does that look like? Brisk walking, cycling, swimming, weightlifting, things that are going to help your cardiovascular system. So those cardio type exercising can help when it comes to the exercising. Next thing we want to look at is lifestyle. What are you doing? How much are you drinking? Are you smoking? What are you doing that could potentially increase or put you at a higher risk for developing high cholesterol, or could worsen if you have already high cholesterol? So we're going to ask you some social questions, right? Your social history. Do you smoke? If so, how much are you smoking? How many cigarettes per day? How many packs per day are you smoking? How long have you been a smoker? Decreasing smoking can lower your HDL cholesterol, and smoking can damage the blood vessels, which in and of itself can cause another issue, right? We've talked about that a little bit before. Maintain a healthy weight. So looking at how much you weigh, your height, your weight, making sure you're within a healthy parameter. We talked about the BMI and what that looks like. It's a guideline that we go by, right? But it's not a cookie cutter, one size fit all thing. So we want to make sure that we are looking at everything total. Limiting alcohol consumption and excessive cholesterol intake can lead to high triglyceride levels. So we want to make sure that we're discussing all these things and that you're having these conversations with your healthcare provider, because if not, then we're missing a major piece of your healthcare puzzle when it comes to making sure that you are healthy and that you're getting the care that you need. Another thing is we want to take a look at what medications are you taking. And like I mentioned before, in some individuals, we've done all the lifestyle changes. They've stopped smoking. They've changed their diet. They're exercising 150 minutes per week. They're doing everything that they need to do and that we're advising them. However, their numbers just aren't budging. And as I mentioned before, there can be a family history or genetic component that's involved that will cause you to be resistant to all of these changes. And when that's the case, we may have to put these individuals on medication for their cholesterol. There's a slew of different types of medications for cholesterol, but the most common one is something called a statin. These medications are prescribed to lower the LDL and they reduce the risk of heart disease. So that low, which is that LDL, the bad cholesterol, we want to make sure that we're trying to keep that low as possible, right? We don't want anything that could potentially cause additional problems. Another thing is regular checkups, physical exam every year, sometimes every 6 months if you're having issues, if you're having, medical conditions that you're needing to be followed up on a routine basis. It's essential to get your regular checkups. Every year, we should all have a thorough physical exam, head to toe. We're in there. They're checking our eyes, our ears, our nose, our throat, looking into our chest, lungs, listening to your heart, all the way down, checking your belly, filling your belly, checking your kidneys, checking your spinal cord, all of that, reflexes and everything. Because one indicator could, something on your physical exam could indicate that there's a problem, that there's something going on. And so if you're not having these physical exams done, we could be potentially missing some major health problems. So let's go back a little bit when we talked about food. What foods elevate the cholesterol? We talked about them, but I want to delve deeper into it. So red meat, the beef, the pork, lamb is high in saturated fat. Processed meats, when we look at that, we think about the bacon. I love bacon. I love bacon. I said I could become a vegetarian or a vegan, but I have to have bacon if that's even a thing. So even me, I have to take into consideration of what I'm eating, right? And I know bacon isn't the best, and we can have a whole debate about that, but we're not talking about meat. We're gonna stick to the program tonight. So hot dogs, sausage, deli meats, those things that contain higher levels of saturated fats and sodium. Full dairy that have the full fat, so whole milk, cheese, butter, cream cheese, things of that nature are high in saturated fat, which then can in turn elevate the cholesterol levels. Lard and palm oil, these fats are often used for baking and in processed food. So we want to be mindful of what we're eating and what we're putting in our bodies. So when we talk about the trans fats, these are found in partially hydrogenated oils and may be in processed and fried foods as well, such as the donuts, the fried chicken, the packaged snacks. Many countries have banned or restricted the use of trans fat due to their harmful effects on our health. Unfortunately, the United States necessarily has not done that, but hey. Highly processed fried foods, we talked about that. The fried foods, the French fries and things of that nature, fast foods. Best thing is to cook your own food. That way you know what you're eating, you know you're putting in the food in terms of any additives and things of that nature. Egg yolks, another one is the shellfish, seafood, lobster, shrimp are higher in cholesterol. Organ meats like liver can also contain a large amount of cholesterol and can affect the heart health. So diet. Make sure you know what you're putting in your body and how much you're putting into your body. So just be mindful of the foods that you're eating. So what are some of the risk factors for having high cholesterol? We know if we're eating foods that are high in saturated fat, we're going to see an elevated LDL. And if there's a family history, that puts you at a higher risk for developing high cholesterol and heart disease. If you're living a sedentary lifestyle, you're not exercising or moving your body as much as you can or as much as recommended, we can see some problems. The age and the gender could be a factor as well. Some individuals who are of certain racial background tend to be at a higher risk for high cholesterol than others. Obesity, smoking, as we mentioned, other medical conditions that you have, such as the diabetes, if you have issues with your thyroid, hypothyroidism, or kidney disease, can affect the way that your body metabolizes the cholesterol, leading to higher numbers in your blood when we run your blood work. Medication. Some medication, including corticosteroids and certain diuretics, can raise the LDL level. So we just have to know what we're taking, what we're eating, and just adhere to the recommendations. So when it comes to living with high cholesterol, there's many, and I didn't pull many statistics on how many people are dealing with high cholesterol, but there's a large number of individuals who are dealing with, who are taking medications, who are living with high cholesterol. And if you're following the advice and the instructions that you're being given, then we can prevent heart disease. We can prevent the plaque from building up in the in the arteries and causing a heart attack and causing a stroke. Many times those things work. The diet, the exercising, paying attention to what you're eating. If you have to take medications, then making sure that you're taking them the way that they are prescribed. So living with high cholesterol often involves making those changes. And sometimes it's a hard decision to make. But when it comes to life or death situations, that's where, even before it becomes a life and death situation, your healthcare provider should be talking with you and working with you to make sure that you are getting the help that you need. If you need additional support because you're struggling with one area, or you've had a family history and it's just, a lot, we can work with you to get you set up with a dietitian, to try and get you set up with a personal trainer, things of those nature. There are so many community resources that are available that we are able to tap into to get to our patients so that they can receive the help that they need, not just in our office, but outside of the office as well. There's support groups. There's so many different Facebook and Instagram groups. Social media is amazing at the things that we can do and the individuals that we can connect to that may have some information that can be helpful for us. So emotional support. As a healthcare provider, we offer the education. We want to make sure that we're supporting you, but also being able to provide you with the emotional support that you need. And that's when a life coach or a health coach comes into play. They may be able to help you with that. Reducing the overall risk of heart disease is going to be impactful by you lowering your cholesterol levels. And so it may mean that you just can't eat all the good things that you like to eat before. There's always alternative to it. So living with high cholesterol can be manageable, definitely. And it doesn't have to greatly impact your quality of life. And that's what it's all about, is quality of life. Making the right changes, getting your diet under control, working out, losing the weight, managing your diabetes. If you already have high blood pressure, managing those things can help overall. So having high cholesterol is not the end all be all. There is definitely something that can be done to help you, even if you are one of those individuals who have a family history and have this genetic component where no matter what we do, those numbers just aren't budging. There's still things that we can do. There's still treatments that are available that can help you. So how often should you be getting your cholesterol levels checked? If your numbers are elevated, we want to at least run those labs at least every 6 months, because if you're to a point where you need to be on medication, we want to make sure, is this medication effective? There are some side effects to each medication, just like there are with any medication that you take. But with some of the most common statins, is what we call them, for cholesterol, many individuals develop really bad muscle cramps. And so if you're starting on any new medication and you start developing symptoms that you did not have, make sure you're reaching out to your primary care provider and letting them know, because we don't want another problem to evolve right out of you taking medication for one situation. So another thing is moderation. I always say this: you can eat what you want, but just in moderation. But if your numbers are extremely high, then we really need to look at what you're eating and maybe make some changes. I talk about alternatives a lot because there's always an alternative to something. I saw a post on social media today where this individual made a ice cream pop, or I think it was ice cream bar or something like that, out of fresh strawberries and Greek yogurt and some dark chocolate. And she said, this is what I do to help my sweet tooth. Like, for me, I have such a sweet tooth, and I know who I can blame on that. I'm not going to call them out tonight, but there's always an alternative. There's always something else that you can do in place of. If you have an air fryer, they're amazing. You can get the fried tasting food without the excess oils that could cause you some issues down the road. Research what works for you. Make sure you have a good relationship with your healthcare provider. Make sure you are getting the care and the treatment that you should be, right? When you're going in, you should be getting the cholesterol. They should take time and go over what those results are. I know now with our healthcare system, we get the results a lot of times before our healthcare provider gets the results. And so, because I know what I'm looking at, I already know what's going on before I see my healthcare provider. However, there are many individuals who don't know what these numbers mean. And recently, both my husband and my daughter had blood work done, and I was able to sit and go over those results with them so that they understood what each and every level meant. That's something that I provide with Wells Legacy Health and Wellness. We provide laboratory review. So if you're confused about something, if you don't know what you're looking at, if your healthcare provider has not provided you with the information that you need, give us a call, reach out, message us, DM us. We can take some time and set up a consult for you and go over those labs, because if you are empowered, if you are educated, then you're able to make the decisions that you need for your health. Our goal with Wells Legacy Health and Wellness is to make sure that our family, our friends, and our communities have the information that they need to create a legacy of good health. And the only way that you can do that is by being able to advocate for yourself and be educated about your overall health, your physical exam, blood work, any abnormalities, anything that may come up. We are here to help you. I just want to say thank you so much for joining us once again for Wellness Wednesdays with Dr. Wells. This is Dr. Latoya Wells. I have an amazing announcement that I will be making on next week. I can't wait to share. Or you can check it out on Facebook or social media. I may post it there. But we have some amazing things happening with Wells Legacy Health and Wellness, and I can't wait to share. I just want to say thank you all again. Take care, stay safe, and be well. This is Dr. Latoya Wells. Until next time, we'll talk to you later. Have a great evening.